All right, so today we're gonna do positioning on a routine chest. The first one, we're gonna do a patient that is lengthwise for the PA and then lengthwise for the lateral, because all patients do a lengthwise lateral. So body habitus would determine whether the patient was done lengthwise versus crosswise. So she is my first patient, and we've already done the video on history taking and changing. So she would have everything off from the waist up with the gown on open to the back. All right, so I'm gonna leave you for a minute. I'm gonna set the control panel first. It's on. So we're gonna choose thorax on here. And then I'm gonna choose PA chest. We're gonna set the technique to 110 kVp at 1.2 mass. And we're on large focal spot, and it's a 72-inch SID, and we're at the wall grid. So that's what we're gonna go in the room and set up for on that. I'll just leave you there for a minute.
Okay.
So in here, this is, my disclaimer is that this equipment, I have not laid hands on it yet. It is new to us. So if I look like I don't know what I'm doing, it quite possibly is true right at the moment. So most of the time when you get your patient, when I look at Mariah, I'm trying to see where she is in relation to me as far as height. She is a little bit taller than me, so I know that the chest board is likely to be a little bit higher than it would be for me, and that's usually where I try to start out with that. I'm gonna move the table out of my way so that the patient and I have the most room. And we're gonna line this up. And we are going to do her (14 by 17) lengthwise, meaning the long axis of the IR is going to go with the long axis of the patient. So I'm 17 this way, 14 this way. I'm going to put left marker because on chest we tend to use left marker. Hasn't been off here in a while. Things you should have thought of before you started the video. Good night. I'm not gonna have to worry about. Oh my gosh. Alrighty. So it's gonna go in the patient will be facing this way, so this is left side. So it's gonna go in the very top left corner over there. I am aligned. The laser is a nice feature. It lets you know that you are aligned top to bottom with that. And you can also see that the light field is lined up on there. So we're good to go with that. We don't have to leave the laser on since we're lined up. And then we'll get our patient and we'll have her come in. Remember, she's in a gown with it open to the back, and we've already done her history, so we'll have her come right up against the board facing that for me. Okay. Nice and close. Good, and we'll put your hands on your hips and just kind of roll your shoulders forward. Now her hair is already out of the way, which is actually a good thing. Hair can show, especially on digital. So thick hair, braided hair, wet hair, fake hair, all of that will show, but her hair is up out of the way, so we're good with that. Central ray on a PA chest is T7, which is found 7 inches below vertebral prominence if I were to do the hand spread, or I can also go by the inferior angle of the scapula. So if you wiggle the patient's arm, hers I can feel right here. So I want to raise my central ray so that it's coming in midline at the level of the inferior angle of the scapula. So I'm going to raise that slightly. And you'll hear me say 1,000,000 times, if you move the tube, watch your chin for me, you move the bucky, and then I will turn the laser on and check that side light, which I'm lined up, so I'm going to move that. And then I'm going to have your arms are good. I'm going to make sure she's in the middle, so she's midline here. And at the lower level, the inferior angle of the scapula right here, so I'm coming across, so that's good. Normally, we would shield the patient, but that is something that is not being practiced currently in our field in the state of Florida. So I'm not going to shield her like they would not do in the field. I'm just gonna have her stay up against there, and I'm gonna tell her that what I'm gonna have you do when I tell you is take in a deep breath.
Okay.
Then you'll blow that all out. Then you'll take in a second deep breath and hold it for me, okay?
Okay.
Good, just like that. Go ahead, take in a nice deep breath. I'm breathing with her. Blow it all out. One more deep breath in. Hold it. Beep. I would make my exposure and then tell her, good, you can breathe and relax. All right, now what we'll do for the lateral, since her central array was at T7 and she was done lengthwise, when I turn her into a left lateral, nothing changes. It's still at the same level of T7, so I don't have to move the tube, I don't have to move the bucky. I literally only change the patient's position. So I'm gonna have you put your left side against the board. Bring both arms out. Put this arm, kind of hold on to that, and just leave this arm. So you want your patient to be standing straight. You don't really want them to have like a huge arch in their back. So you want to feel her back, and I want to make sure that my hand kind of stays perpendicular to the board, so she's definitely nice and straight. I can feel she's not rotated there. And then this central ray is going to stay at the same level of T7, but midline now becomes mid-axillary. So it usually is in line with the axilla, and if you split her in half from front to back, where my thumbs meet is where that line is, which means she's in the center that way. There's not a lot of OID between her and the board. Take a tiny step sideways for me. Good. There you go. That's even better. Marker stays the same. Midline, T7. I'm gonna have you do the same kind of breathing, okay? I'm gonna change the technique back here, so as I'm walking back, I'm already anticipating that. I'm gonna tell her, go ahead and take in a deep breath. Blow it all out. Take in another deep breath. And hold it. Beep. Good. Breathe and relax. That technique was 110 at 3.4 on that digital unit. So what I would do at this point is I would check both those images, make sure I had all the pertinent anatomy. I would answer any questions that the patient has. Likely I'm going to tell her that those results will be back to her doctor within 24 to 48 hours, and then I would let her change and I would walk her back out. And that's a routine chest.